I'm very happy to be here. This is a wonderful symposium, wonderful venue, wonderful faculty, and I'm very happy even more to give you an update on our experience with Fenfluramine, especially in Dravet syndrome. I will tell you a couple of historical points before I actually want to show you the data of the first phase 3 randomized controlled, placebo-controlled trial. So actually, as you know, Fenfluramine is a drug that was used against obesity. And what we know at that time and still right now, it has something to do with serotonin. It does increase serotonin levels in the brain. There were in the 70s and the 80s case reports, especially from France, about the effect of Fenfluramine on self-induced seizures and photosensitive seizures. But because of various serious side effects, pulmonary hypertension and valvular problems of the heart, the product was actually withdrawn from the market in 1997, so it is still forbidden. Now you have to understand it was forbidden because of these side effects, but if you look into the files, people who had these side effects really took much more than the prescribed dosage. So usually the prescribed dosage was 60 milligrams, but typically the patients who had big problems had a dosage of more than 120. Now in Belgium, we are a special country of compromises, because we had good results in some of these children with photosensitive epilepsy, and I will show you, we could still continue. So actually we were the very single place on earth where we could continue to use Fenfluramine in epilepsy. Now it started, and I will just show you one historical paper by Jean Cardi, published in New England Journal of Medicine in 1986, and he describes 3 adolescents or young adults with photosensitive epilepsy or compulsive induced epilepsy, and he treated these 3 psychotic adolescents with epilepsy with Fenfluramine at 60 milligrams per day, and he noted that all the seizures were gone and that this compulsivity was also gone. And actually, because in patient 1 on the EEG, he could also prove that there was a positive effect on the EEG photosensitivity, he wrote in the discussion, perhaps we should continue, or we should try to look for Fenfluramine as a possible anti-epileptic drug. So that's what we read, and that's what happened actually in probably a couple of centers in Europe, but also in our center. So we had this is a summary of what is available, and you will see it's not too much. We have these case reports, and I showed you one. We had then in Belgium our observational study, retrospective observational study, 11 patients, then a long-term retrospective study and 12 patients, then another prospective study and 9 patients, but actually the main study is a double-blind placebo-controlled trial that is just finished in 120 patients. So this first observational study, so this was after the French experience, we tried in our center Fenfluramine in, at that time called intractable self-induced epilepsy. We didn't look for Dravet or severe myoclonic epilepsy of infancy. We knew it could be possibly used in photosensitive epilepsy, so we tried it in 11 patients. And as you can see, all these patients have self-induced seizures. Most of them had photosensitivity. Age of onset was very young in these children. Some of them had a familial epilepsy, most of them had intellectual disability, and they had mostly tonic-clonic seizures. So in these 11 patients, Fenfluramine was tried, but in a much lower dose, 0.5 to 1 milligram per kilogram per day. And the effect in these 11 children was remarkable in the sense that in all 11, at least 75% reduction of seizures was seen. Now, if you look more carefully, most of these children were on valproate. The dosage, as I told you, was very low, 0.5 to 1 milligram per kilogram per day, and the follow-up was longer than the typical 12 weeks that you would see in a randomized controlled trial. Now, this was still photosensitive epilepsy, induced epilepsy, refractory epilepsy, but we looked at the files of these 11 children, and actually the clinical story of 5 of these children was very compatible with Dravet syndrome, what we would call afterwards Dravet syndrome. And we tested these 5 children for the SCN1A gene, and they were positive. So actually in these 11 children, there were 5 Dravet children, and that's why we got the idea we should continue to try Fenfluramine in Dravet syndrome. And that was the story that ended in 2012 with this retrospective survey of 12 children with Dravet syndrome, where we used fenfluramine. So this was, as you can see, add-on therapy. We had a clinical and cardiac follow-up because we knew about the side effects. And we did the first analysis in 2010. Now again, this is still only retrospective, but at that time in 2010, so in these 12 children with Dravet syndrome, 10 were still on fenfluramine and 7 were seizure-free. 7 out of the 10 were seizure-free for more than 1 year. And actually the main seizure freedom time was like 6 years, between 1 and 19 years. And I don't think this is the natural history in the majority of Dravet syndrome. 1 of them had a 75% reduction, and in 2 of them we didn't see any effect. In the other 2, the fenfluramine was stopped during the follow-up because in 1 there was no effect. And then the other one, he was seizure-free, and he remains seizure-free, so it was not restarted. So this retrospective study confirmed actually for the first time that probably fenfluramine is useful in Dravet syndrome. Now this was 2010, so we followed these children for another 5 years, and here you see 1, 2, 3, 4, 5, 6, 7 children who were seizure-free in 2010. You see that the majority remained seizure-free, and actually there was another child who actually became almost seizure-free, this particular child. So this long-term follow-up of these original 10 children confirmed again that most of our children remained seizure-free. In the meantime, we started a new prospective study, so these were new 9 patients with Dravet syndrome, again looking at the effect of add-on fenfluramine low dose, and we actually could confirm, but this was not yet placebo control, we could confirm a dramatic decrease of seizure frequency. So after 1 year follow-up, not after 12 weeks, but after 1 year follow-up, you see that 7 out of 9 of these children had a more than 70% seizure reduction. But then, of course, we were very happy that this story was taken up by a company, by Zogenix, and we designed together with Zogenix a clinical program. So there are a couple of studies running, the 1501, the 1502, and the 1504 are the most important ones. The 1501 and the 1502 are the 2 studies I will report on. And so 1501 is done in the United States, and 1502 is done in the rest of the world. I think this is a very Trumpian way of looking at the world. You have the States and you have the rest of the world. So these studies were very similar, where they would compare a placebo with 2 dosages of fenfluramine, 0.2 milligrams per kilogram per day or 0.8 milligrams per kilogram per day with a maximum of 30. Remember, the dosage for obesity was 60. But we excluded stiripentol in these 2 first studies. And there was another study, 1504, almost finished right now, and Rima is the principal investigator, only done in Europe, where we would include children with Dravet syndrome on stiripentol, and here we only test 1 dosage, placebo plus 0.5 milligram per kilogram per day. Actually, I will report on the left side, 1501 and 1502, and the FDA forced us in a way to do a very, very similar study to the CBD study that Helen was presenting. So actually you can compare in a way the results of both studies. Study was a very typical study, so you had screening, 6 weeks of baseline observation, and then a comparison between placebo, 0.2 milligrams per kilogram per day and 0.8 milligrams per day. And we have 2 primary outcomes. Of course, the reduction of seizure frequency and the number of responders. Now, if you look at seizure frequency reduction compared to placebo, we see like 64% decrease of seizure frequency in the highest dose and about 34% in the lowest dose. So 0.2 is 33.7% and 0.8 is 63.9%. So there's a major decrease of convulsive seizures in this study. And there is a dose dependency. Now, even more striking is if you look at responders, and if you look at the classical way of responders, the 50% reduction rate, so you see that we had a placebo only of 7.5%, and in the 0.2 in blue it's 41%, and in the 0.8 is 70%. So 70% of the children getting the highest dose were a responder. If you go to the right side of the slide, 75% reductions, about 50% still had a reduction of more than 75%. So these now placebo-controlled study results actually confirm what we found in all these retrospective smaller studies. Now there are other ways to look at the effect of fenfluramine. We also looked at the longest seizure-free interval during the trial, and the trial was 2 weeks and then 12 weeks, so 14 weeks in total. In the placebo group, you see that you can have a period of like 10 days without any seizures if you have Dravet syndrome. If you give fenfluramine, you see at the highest dose that in many children it went up to like almost 1 month seizure freedom. The other way to look at efficacy is seizure freedom or near freedom rates, because we saw in the study results that many children actually during the full trial only had 1 seizure. I have to say you that the inclusion number of seizures, so during the baseline it was 40 per month, and the majority of these children went from 40 per month to 1 to 2 seizures per month, or seizure freedom. So we looked at this new parameter, seizure freedom or near seizure freedom rate, which is 1 seizure in the whole study. And you see for placebo this is 0%, 0.2 milligrams it's 7.7% seizure freedom plus 5% 1 seizure. And then in the 0.8, if you add up everything, it's like 25% or 26% of the children becoming almost seizure-free or seizure-free. Now, what about safety? Of course, we were very concerned about the cardiac safety, and again, the FDA forced us to follow a program with a separate committee looking at blindly at the cardiac data. So we had to do ECGs and echocardiography in all children, and actually, very luckily, we didn't see any sign of cardiac problem in this cohort, in this study. If you look at the typical other adverse events, it was dose-related, and actually in the highest group, 5 children had to stop the trial because of serious adverse event, but this was mainly breakthrough seizures or decreased appetite or some drowsiness. So typical side effects you would see in central nervous system drugs. So actually I'm quite convinced now after this placebo-controlled trial that fenfluramine is helpful in Dravet syndrome. We are still waiting for the other trial with stiripantol. First signs of the results are also very positive. There is a study going on in Lennox-Gastaut right now. So I think within 1 year or 2 years, probably also this drug will be on the market. Thank you very much.